Welcome to the world of nursing. Before we dive into the procedures and hands-on care, we need to build a strong foundation. That foundation begins with understanding anatomy, the structure of the human body, and physiology, how the body functions. These two fields are the blueprint of nursing practice. Imagine a mechanic trying to fix a car without knowing where the engine is, or a chef preparing a meal without understanding the different ingredients. Sounds impossible, right? That's exactly why anatomy, the study of the body's structure, is crucial in healthcare. As a nurse, your job is to care for patients and help them heal. To do that effectively, you need a solid understanding of how the human body is put together. Think of anatomy as the roadmap that guides you through the intricate network of organs, tissues, and cells that make up a human being. Knowing your anatomy means knowing where each organ is located, its size, and its relationship to other organs. This knowledge is essential for performing tasks such as taking a patient's temperature, measuring their blood pressure, or even just positioning them comfortably in bed. Without a firm grasp of anatomy, providing effective healthcare would be like navigating a maze blindfolded. Now let's talk about physiology. If anatomy is the what of the body, then physiology is the how. It's the study of how all those amazing body parts we learned about in anatomy actually work together. Think of it this way. Anatomy is like looking at a bicycle and understanding the frame, wheels, pedals, and handlebars. Physiology, on the other hand, is understanding how pedaling turns the wheels, how the brakes work, and how steering the handlebars directs the bike. In healthcare, understanding both anatomy and physiology is crucial. Nurses use their knowledge of anatomy to locate the best place to listen to a patient's heart or lungs. They then use their understanding of physiology to interpret what they hear. A fast heartbeat might indicate stress, while a rattling sound in the lungs could signal an infection. The human body is a complex and fascinating machine, but just like any complex machine, it's built from smaller, simpler parts working together in perfect harmony. Let's break down the levels of organization in the body cells. The smallest living units of the body, they're like tiny factories, each with a specific job to do, like carrying oxygen, red blood cells, or fighting off infections, white blood cells. Tissues, groups of similar cells that work together to perform a specific function. For example, muscle tissue helps us move, while nervous tissue carries signals throughout the body. Organs, structures made up of different tissues that work together for a common purpose. The heart, for instance, is made of muscle tissue, connective tissue, and nervous tissue, all working together to pump blood. Organ systems, groups of organs that cooperate to carry out major bodily functions. The digestive system, for example, includes organs like the stomach, intestines, and liver, all working together to break down food and absorb nutrients. Understanding this hierarchy is crucial for nurses. It allows them to connect the dots between different body systems and see how a problem in one area might affect the others. For example, a problem with the lungs, respiratory system, can impact the heart, circulatory system, because the lungs are responsible for oxygenating the blood. Imagine describing the location of a freckle on your friend's arm without using words like above, below, left, or right. It would be pretty difficult, wouldn't it? That's where directional terms come in handy in anatomy. These terms provide a standardized way to describe the location of body parts in relation to each other. Here are a few examples. Anterior, ventral, toward the front of the body. Your nose is anterior to your ears. Posterior, dorsal, toward the back of the body. Your spine is posterior to your heart. Superior, cranial, toward the head. Your shoulders are superior to your hips. Inferior, caudal, toward the feet. Your knees are inferior to your waist. Medial, toward the midline of the body. Your nose is medial to your eyes. Lateral, away from the midline of the body. Your ears are lateral to your cheeks. These terms might seem a little intimidating at first, but they're essential for communicating clearly and accurately about the body, especially in a healthcare setting. If you're finding this video helpful, don't forget to hit the like button, share it with fellow nursing students or healthcare professionals, and subscribe to Nurses Notes for more educational content every week. Gap 2S. Now, let's talk about how this anatomical knowledge is put into practice. Imagine you're a nurse administering an intramuscular injection. Knowing the exact location of muscles, nerves, and blood vessels is paramount. For example, the deltoid muscle in the shoulder is a common site for injections. But why? It's easily accessible and thick enough to absorb medication, minimizing the risk of hitting a nerve or blood vessel. Gap 2S. Similarly, understanding the anatomy of the cardiovascular system is crucial when inserting an IV line. The cephalic vein in the arm is often chosen for its size and accessibility. However, knowing the surrounding structures helps avoid complications like hitting an artery or causing a hematoma. Gap 2S. Whether you're performing a simple procedure or a complex intervention, a solid grasp of anatomy ensures precision and safety. It's not just about memorizing terms and structures, it's about applying this knowledge in real-world scenarios to provide the best patient care possible. Now let's imagine slicing a loaf of bread. You can slice it lengthwise, you can slice it across, or you can slice it at an angle. Similarly, in anatomy, we use imaginary planes to divide the body and visualize its internal structures. The three main body planes are sagittal plane, divides the body vertically into right and left halves. Imagine slicing a person straight down the middle from head to toe. Frontal, also known as coronal plane, divides the body vertically into front and back sections. It's like slicing a person from ear to ear, dividing them into a front and back half. Transverse or horizontal plane divides the body horizontally into upper and lower sections. Think of slicing a person across their waist, creating a top and bottom half. Understanding these planes is crucial for interpreting medical images like X-rays, Connecticut scans, and MRI scans. Knowing which plane an image is taken in helps doctors and nurses visualize the body's internal structures and identify any abnormalities. Section 6. Anatomy and Physiology in Action, a Nurse's Perspective. Let's bring all this knowledge to life with a real-life example. Imagine you're a nurse caring for a patient who's just had surgery. Your understanding of anatomy and physiology is crucial for monitoring vital signs. You'll use your knowledge of the circulatory system to measure the patient's heart rate and blood pressure, ensuring their heart is functioning properly. Assessing pain. Understanding the nervous system helps you assess the patient's pain level and administer appropriate pain relief medications. Promoting healing. Knowing how the body repairs itself allows you to provide wound care and encourage proper healing. Educating patients. You can use your knowledge to explain medical procedures to patients, helping them understand their care plan. These are just a few examples of how anatomy and physiology are woven into the fabric of nursing practice. Every task a nurse performs, from the simplest to the most complex, relies on a solid foundation of anatomical and physiological knowledge. Section 7. Vital signs, the language of the body. Think of your body as a complex engine, constantly humming with activity. Vital signs are like the gauges on a dashboard, giving us essential information about how well that engine is running. As nurses, you'll become experts at measuring and interpreting these vital signs. And temperature reflects the body's internal heat balance. A fever, for example, can indicate infection. Pulse measures the heart rate, indicating how fast the heart is pumping blood. Respiration tracks the number of breaths per minute, reflecting how well the lungs are taking in oxygen and releasing carbon dioxide. Blood pressure measures the force of blood against the artery walls, providing insights into the health of the circulatory system. By monitoring these vital signs, nurses can detect early warning signs of illness, track a patient's response to treatment, and ensure their vital organs are functioning properly. Section 8. The power of observation, a nurse's keen eye. Nurses are often the first line of defense in healthcare. Their trained eyes and ears are constantly on alert, looking for any subtle changes in a patient's condition. This keen sense of observation is rooted in a deep understanding of anatomy and physiology. By knowing what's normal, nurses are better equipped to spot what's not. For example, a nurse might notice swelling in the legs could indicate a problem with the circulatory system. Yellowing of the skin, jaundice, could signal a liver issue. Changes in skin color or temperature might suggest poor circulation or infection. These observations, coupled with vital sign readings and other assessments, allow nurses to paint a complete picture of a patient's health status and advocate for their needs. A final word. The human body is an extraordinary machine, capable of remarkable feats of strength, resilience, and healing. As you embark on your journey into the world of healthcare, remember that understanding anatomy and physiology is not just about memorizing facts. It's about gaining a deeper appreciation for the miracle of life itself. By embracing the interconnectedness of the body's systems, mastering the language of anatomy, and honing your observation skills, you'll be well on your way to becoming a compassionate and effective healthcare professional. Keep asking questions, stay curious, and never stop exploring the wonders of the human body.